Hi everyone, my name is Iktha Monget, and today I'll be presenting a comprehensive overview of Alprazolam, which is commonly known by its brand name Xanax. This presentation is part of HSC 3503, or the Principles of Toxicology, in summer 2024. Here's just a brief overview of what we will cover today. We'll start by understanding alprazolam, followed by its medical uses and dosage, and then we'll discuss the side effects and precautions associated with its use. Next, we'll address addiction and withdrawal aspects, which are very important with this drug. And finally, we'll conclude with a summary and maybe some questions. When it comes to understanding alprazolam, the best place to start is with the chemical formula. So, chemically, it is known as carbon 17, hydrogen 13, chlorine, and nitrogen 4. At the bottom of the slide, you can see a 3D representation of the chemical itself. Alprazolam is practically insoluble in water, but it is soluble in other organic solvents like ethanol, methanol, and dimethyl sulfoxide, or DMSO. It typically appears as an odorless white crystalline powder that is slightly acidic in nature. It has a molecular weight of 309.77 grams per mole and a melting point of between 228 and 229.5 degrees Celsius. It is primarily metabolized in the liver by the CYP3A4 enzyme, which is then excreted from the body through urine with about 20% unchanged. It also has a high oral bioavailability of around 80 to 90%. The half-life of alprazolam is between 11 and 16 hours, and it has an onset of action within 1 to 2 hours. It does reach its peak effectiveness 1 to 2 hours after it is administered, but its effects endure between 4 to 6 hours. In order to really understand how the body handles alprazolam, it's important to go over the ADME profile, which corresponds to absorption, distribution, metabolism, and excretion. So each picture from left to right corresponds to a different part of the profile. So starting with absorption, alprazolam is well absorbed from the gut after oral administration. So that means 70% of the medication is reaching the bloodstream, which also means that it has an oral bioavailability of around 70%. The effects typically start to kick in within 1 to 2 hours, and food might slow down the absorption slightly, but it doesn't significantly impact the total amount of the drug that enters the body. The second picture corresponds to distribution. And due to its lipophilic nature, which means that it's fat soluble, it readily dissolves in fats. So, this allows it to cross the blood brain barrier and reach its target site in the brain really effectively. It's important to note that around 80% of alprazolam in the bloodstream is bound to proteins, leaving only a small portion free to exert its therapeutic effects. Um, the next picture is a picture of the liver enzyme CYP3A4, because the liver plays a major role in eliminating alprazolam from the body. So, this enzyme is responsible for breaking down the drug into its primary metabolite, alpha hydroxyl alprazolam. Sorry. This metabolite also has some anxiety reducing effects, and the liver forms other inactive metabolites that are eventually eliminated. And the last picture is for excretion. The kidneys are the main route of excretion for alprazolam and its metabolites. They're eliminated through urine. And the elimination half life of the drug is approximately 11 to 16 hours. So, this shows that it takes roughly this amount of time for the body to get rid of half of the medication. Um, Understanding this, the ADME profile, is essential for safe and effective use. So, what is alprazolam? Alprazolam belongs to the benzodiazepine class of medications, which we'll talk a bit more about later. It's fast acting and it is one of the most commonly prescribed psychotropic medications in the United States. So, you probably know somebody who is prescribed Xanax or takes it regularly. It's primarily used for its anxiolytic effects, providing quick relief from anxiety symptoms. So, in regards to alprazolam's mechanism of action, it works by enhancing the activity of the GABA neurotransmitter in the brain and nervous system, which leads to anxiety relief. It has a moderate duration of action that typically lasts a few hours. If you look to the left of the screen, you can see a diagram showing how alprazolam works by interacting with the GABA or gamma aminobutyric acid system in the brain. So, there's the presynaptic neuron, and this neuron normally releases GABA, the main inhibitory neurotransmitter in the brain, and it then binds to receptors on the postsynaptic neuron. So the postsynaptic neuron has GABA receptors, specifically GABA A receptors. So when GABA binds to these receptors, it allows chlorine or chloride ions to flow into the neuron, making it more negative and less likely to fire. Um, so alprazolam doesn't directly trigger the GABA receptor; it just acts as a positive allosteric modulator. So it like binds to the specific site on the GABA A receptor, which is distinct from the GABA binding site. This binding leads to a change of shape of the receptor, so it makes it more sensitive to GABA. And as a result, even low levels of GABA can cause a stronger inhibitory effect on the postsynaptic neuron. So, in essence, alprazolam amplifies the calming effects that GABA has in the brain, which leads to decreased activity and a calming effect of the brain. It's super important to talk about the legal and safety considerations that come with alprazolam. So, one, it is a prescription medication. So, that means it's only available if a provider prescribes it to you, and it 100% should always be used under medical supervision, not recreational at all. Safety concerns include the potential for misuse, dependency, and adverse effects. So, it can increase the risk of serious or life threatening breathing problems, sedation, or even a coma if used alongside other medications. And we'll talk more about that in a later slide. And due to its potential for abuse and addiction, it is classified as a controlled substance in the US. Like I've mentioned before, alprazolam is widely known by its brand name Xanax. It's also known as Naravam or Xanax XR. XR means extended release. And it's favored in medical practice for its fast acting relief. It's primarily used to treat anxiety disorders like generalized anxiety disorder and social anxiety disorder. And it helps patients by reducing the symptoms that are usually associated with these conditions, like excessive worrying, nervousness, and restlessness. It can also be effective in managing panic disorder, which is characterized by sudden and unexpected panic attacks with intense fear, and physical symptoms like the shortness of breath, chest pain, dizziness, and heart palpitations. Alprazolam is available in tablet form, extended release tablet form, and oral solutions. all of them are taken orally. The photo on the screen shows the tablets, the different types of tablets that it comes in. The most common is on the top row and the farthest to the right, and it's a bar, and the bar allows the doses to be divided. So the 2 milligrams can be split into 1 milligram or 0.5, and so on. So the dosage is individualized based on the patient's condition and response to treatment and other medications they might be taking. But here are some general guidelines. So patients who have generalized anxiety disorder have a starting dose between 0.25 milligrams to 0.5 milligrams 3 times daily. And it is recommended that they don't exceed the maximum dose of 4 milligrams daily. So then there's patients who have panic disorder, which Xanax can also be used to treat, and they have a starting dose of 0.5 milligrams 3 times daily, and the maximum recommended dose is 10 milligrams daily. Then there are special considerations for people with hepatic impairment or geriatric patients, and they have a starting dose of 0.25 milligrams 2 to 3 times daily, but adjustments should be made based on their tolerance and response. Some more treatment guidelines. Alprazolam is typically prescribed for short term relief due to its risk of dependence. Um, Also, when discontinuing alprazolam, this should be done gradually and under medical supervision to mitigate the withdrawal symptoms. So, patients should always be following their provider's instructions for the safe and effective use of this drug. I did briefly mention some of the special populations on the slide about dosages, but it is important to note that for geriatric or elderly patients, lower dosages are usually recommended to minimize the risks of adverse effects. And the same for use in pediatrics and for people who are pregnant or lactating, because there are potential risks to the fetus or the infant.